Good morning, everybody. Happy Thursday. This is April 22nd, and this is the Anchorage Emergency Operations Center update. A reminder that this presentation is being recorded. And here we are, folks, our Alaska famous Maltosi getting his shot. Situation. Can we get an update, please?
Yes, this is Adrian Doobie with the situation update. And in Anchorage, of those cases, we have an additional 243. Those 4 hospitalizations are in Anchorage. We have filled or satisfied 1,732 requests, and we have currently open and working 19. For non-critical transport, in the last 24 hours, we had 31, 1 after hours. In sheltering, in the congregate shelters, we have 424 clients. In non-congregate shelters, we have 309 clients for a total of 733 clients in all shelters, and meals 2,199. Sample collection testing, we have 757, which is a rate of 69 per hour. And vaccinations, increased doses at Dempsey was 145. At the blood bank was 60. Shiloh increased dose, 157. In Diamond, we had 300 additional doses. Northway, an additional 37 doses. Visit Health mobile unit was an additional 4 doses. And at the Alaska Airlines, it was an additional 325 doses. End of report.
Weather.
Good morning, everyone. This is Michael Cutts with the National Weather Service office out at Sand Lake. We're looking at what my East Coast aunt would call absolutely gorgeous weather. And it's going to be mostly sunny days, mostly clear nights, mild, and just a little breezy along Turnagain Arm. And that concludes my briefing.
Operations.
Good morning. This is Joe Calavig, EOC Operations Section Chief. Thank you to PIO for throwing the vaccine link dashboard in the chat there. Going on to mass care, QNI has projected 13 discharges today through Saturday and will discharge 4 today. Warming Tent had 31 people over the past 24-hour period. With public health branch testing, Visit Healthcare testing had a week-to-week decrease of 9.77%. The 7-day rolling positivity rate is 2.54, a slight increase. And pop-up testing for this week will be this Saturday, April 24th, at Mountain View Elementary School, 08 to 7 p.m. The medical countermeasures branch for vaccines, the CDC is set to meet tomorrow on the J&J vaccine. All Visit Healthcare sites are now accepting walk-ins at all times. Anchorage COVIDvaccine.org now has a today filter, so you can see what's available today only, and includes Costco and Cars appointments. So big thanks to the I team on that. And then the first week of May is going to be vaccine week. And so far on our planning efforts, the pop-up clinics conclude May 1st at the Girdwood Community Center and the Northway Mall event. May 5th, Eagle River Library, which is where the testing site is currently located. We're going to add the vaccine site there for vaccine week. May 6th at the Spenard Food Truck Festival, and then May 8th at the Hotel Captain Cook. Those are what we've confirmed so far, with more to come. Again, a reminder, mobile vaccine teams and homebound or home-based vaccinations can be requested by phone at 907-531-5100. End of report.
Logistics.
Hey, good morning. It's Scott Carpenter with Logistics and the EOC. Here's your broad brush look at logistics support for COVID-19 support. In medical countermeasures, we continue to work on the vaccination sites as always to include now vaccine week requirements. Moving down to mass care support, we continue to work contract modifications to support shelter operations through the transition. Those types of contracts include non-congregate sheltering sites, as well as the wraparound support services required to support the PEH, or persons experiencing homelessness. Down to the EOC and AHD support, we continue to work staffing request, transitional planning, and event planning. And as a monthly friendly reminder, if Organizations have a disruption in their supply chain for PPE and test kit request. You can still request that utilizing the information identified on this slide. Been any questions? That's logistics for today. Thank you.
Finance.
Good morning. This is Carrie Wiedeker, the EOC Finance Section Chief reporting. Today, the EOC has encumbered $18,800,129. Our actual spent to date is $48,968,933 for a total of $67,769,063. Please continue submitting invoices and submitting and supporting documentation to EOC invoices at anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery in the form of FEMA public assistance. For more information about that, please contact Erin, spelled E-R-I-N, Zachary at anchorageak.gov. End report.
Safety.
Good morning. This is Annalisa Roberts reporting out for safety. Saturday, April 24th is National Prescription Drug Take-Back Day, which addresses the crucial public safety and public health issue. All too often, unused prescription drugs find their way into the wrong hands, which is dangerous and often leads to tragedy. This event is designated to encourage people to clean out their medicine cabinets and turn it in safely and anonymously. Turning them in and not flushing them helps keep people safe and helps cleaning and treating wastewater to keep people safer and help the environment. So it's this Saturday, April 24th from 10 a.m. to 2 p.m. at the locations listed on the attached flyer. That's it.
Public information.
Good morning, everybody. This is Kel Casey reporting out for the EOC PIOs. On the social media pages, we're sharing several of the pop-up clinics, including the Conquer COVID Alaska Club South GCI, the New Hope Baptist Church, and there's an LGBTQ clinic also available in Anchorage. We're sharing more general emergency disaster-related posts to engage more people with a variety. PIO Rep is working on a flyer for Vax Week to pass along to our community partners and peer leader navigators. Atwood's is coordinating pet therapy dogs with MCM for Vax Week to be at one of the pods. Indoor outdoor is to be determined. Solidifying details for the vaccine week for the ICs and presenting early next week to brief them thoroughly. Working with our community partners in crafting various messaging to target specific demographics and concerns to address vaccine hesitancy. Collaborating with the mayor's office on the Humans of Anchorage project and monitoring status of J&J, working on the messaging for the anticipated Pfizer youth 12 to 15, which is now somewhat anticipated for mid-May, potentially third week of May. And our daily outreach email went out today with 8 flyers and all sorts of updated iTeam Anchorage Vax information on it. End report.
Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage Emergency Operations Center. I'd like to thank all of our partners who are able to join us today. And we'll go ahead and start out with a report out from Jim Baldwin with Food Bank of Alaska.
Good morning. This is Jim Baldwin, Food Bank of Alaska. We have been contacted by the EOC to see if we could assist with the use of the Sam's parking lot for a possible pop-up vaccination site. I've reached out to the Walmart real estate division, and they are open to a Zoom call tomorrow with the appropriate representative from the EOC, whoever that might be. And I'd be happy to coordinate that and set that up to get that dialogue going. Please contact me. You have my contact information, and I'll set that up to see if we can't be assistance. We're happy to help coordinating that. Any questions? Thank you.
All right. Thank you so much, Jim. That's very valuable. We'll go ahead and move right into the hospitals. And Alaska Native Medical Center sent in their numbers this morning, and they've got 3 positives, 0 in the ICU, 0 on ventilators, and 1 person under investigation. And is Sean on for Alaska Regional Hospital? All right, sounds like Sean wasn't able to join us today. Is Michael on for Providence, Alaska Medical Center?
Yes, good morning. We have 9 positive patients this morning, 1 in ICU, none on ventilation, and 7 who have recovered but are still inpatients.
Great. Thank you very much, Michael. And do we have Captain Arbach or anyone else on for the 673rd Medical Group?
Good morning, it's Sergeant Perez with the 673rd Medical Group. Still only reporting out our vaccination numbers. So total first dose is 8,258, fully vaccinated 6,630, and total vaccinations total vaccines administered 14,888. Pending any questions, end of report.
Thank you so much, Sergeant Perez. And that's all for liaison. Thank you.
Thanks, Celeste. And Bob.
I want to thank our mission partners for all they're doing as we come together to deal with COVID in the community. The food bank collaborating on the vaccine business is welcome. Our total full force partners over at JBear just stepping up and taking care of business on base 2 is great. And just the incredible effort of all of us is inspiring to watch as we go forward. We know we still got a ways to go, but pulling together sure helps. End of report.
Great. Thank you, Bob. So our next meeting will be Monday the 26th. Thanks, everybody. Have a great weekend. Enjoy the sunshine.